And welcome back. I'm Mabel Jong. Thanks for joining us. You're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. And in our studio, we have Dr. Robert Pearl. It's so great to see you, Dr. Pearl.
Thanks,
Executive
Mabel.
Director of the Permanente Group. Now, Dr. Pearl, you had talked about specific measures for quality, achieving quality, but you do think that it's hard to look at individual doctor ratings and make a big deal out of that. What do you think we should make a big deal out of?
Sure. I think two things, Mabel. I think, first of all, care is getting so complex, particularly for things like heart disease and cancer, even for total joints, that it requires teams of physicians to be able to provide the best care possible. And so what should be evaluated, and increasingly the nation's moving in that direction, is the outcomes by groups of physicians. So the National Committee for Quality Assurance had its 5-star ratings, Medicare has its 5-star ratings, a lot of the exchanges have their 5-star ratings, and that's so crucial because now you're looking at something you actually can compare. It's no longer a single doctor, it's a team of physicians providing that particular care. And if you look at what's required to be able to achieve those outstanding outcomes, and I'll use this as an example, we've lowered the chances of our patients dying from heart disease 30% below the community around us. Chance of dying from sepsis, systemic infection, 40% below. And if you have AIDS, HIV, 50% less chance of dying if you're a member of Kaiser Permanente. And it's our structures, the integration, people working together as one. It's the movement from fee-for-service to prepayment or bundled payment. Why is that? Because now people focus on prevention, avoid the complications, increase patient safety. All the things start to align. Number 3, the technology. If you're getting care any place and your doctor doesn't have your comprehensive information, how is he or she going to figure out what it is that you need? How is he or she going to make sure that they don't make a mistake and give you a medication that's going to contradict something else that you're taking? Maybe you didn't remember to tell the person that particular information, but it's crucial to your care. And then finally, I believe very strongly that we have to have physician leadership. That doctors simply will not follow hospital administrators or insurance company executives. They will follow colleagues that they know, that they trust, that they've worked with, and that is the process by which change occurs, and patients get better care, higher quality, lower death rates, and more convenience.
Are the physicians willing to step up to this?
In Kaiser Permanente, they love it. I mean, that's why they joined Kaiser Permanente, because they want to have the interests of the patients, and there's a line. And what's the way to align it? Well, if I avoid a complication, everyone does better.
Right.
If I do prevention and you don't get a heart disease or a stroke,
Yeah.
what could be better than accomplishing all that? The worst thing for a physician is a complication. Imagine you prescribe a medication and the patient has a reaction. So it all aligns as long as the system works. Integrated, prepaid, technologically enabled, and physician-led.
Okay. Now, we see some provider groups coming up and opening up their own health plan, for instance. How do you like that kind of movement?
Well, this is the direction. Everyone's trying to move in that direction. You have the providers who are trying to create a health plan. You have health plans that are trying to take on providers, because everyone understands that when it all comes together as one, it's better. The hard part for American medicine is getting from here to there. If you're getting paid prepaid, to all of a sudden if you're getting paid fee-for-service, now all of a sudden get prepaid, what are you going to see? You're going to become more efficient. Your volume's going to drop. Your revenue's going to drop. It's very hard for someone to say, oh, but I'll get more patients in the long run, because the short run is often how people see it. The same thing at the patient level. I just came from a panel on consumerism, and the moderator, sophisticated, smart individual, said she can't communicate with the physicians except by going to the office. We do 13 million virtual visits a year, 16 million in-person visits a year. The virtual visits are going up double digits. The in-persons are relatively flat, but 2018 will do more virtual care than inpatient care. Higher quality, done immediately, and at no cost to the patient. It's the future of American healthcare. Getting there is the hard part.
How did you get your Kaiser patients to be so educated in that area?
So because of the areas that I lead, which is California and then Mid-Atlantic, which are very, very sophisticated communities, they're already educated. They spend a lot of their life on their computers. They all get stuck in the traffic and the commute. Time to them is very, very important. And so we have over 70% of our patients have signed up to have access through a mobile device, through a video system. And for them, it's wonderful. Why would you want to spend a half day driving around the Beltway trying to get to a physician when he or she can make a home visit using video If you use Skype with your family, why would you want to use video? If you send secure emails and text messages to your kids, why would you not want to be able to do that with your physician? It's the medical establishment that's the limiting factor, and I think the major driver of that is economic. It's actually not technological.
Okay, and did also Kaiser spend a lot of time investing in that process too?
We definitely invested in the comprehensive electronic medical record. That's expensive. But I gave every physician an iPhone a year and a half ago. And it's been so revolutionary as people figure out how do doctors talk to doctors real time? How do they use text to not interrupt each other? How do they communicate with patients in follow-up? What we realize is in medicine you often want a small snippet of information. But the only way you can get it is through a visit. That's 20 minutes or 25 minutes of time.
Right.
How do we have more frequent visits so I can come and check on you 3 times a week, maybe for 5 minutes at a time, rather than forcing you to come in once a week and be able to spend 20 or 30 minutes of my time, but 4 hours of yours and your family members if any chance you don't drive.
Now, if for this panel that you were on, what really stuck with you that you took away, and what are you leaving with attendees from that?
So the first thing I believe is that consumerism is not just a label or phrase. It's actually a fundamental shift from the time of the physician, the convenience of the physician, the preferences of the physician being all that matters, to also now bringing in the patient. My view as a proponent of consumerism is that you should have in your healthcare what you have in the rest of your life. What's a good example of that? Well, let's just say that you want to check your financial records or your bank statement. You go online when it's convenient for you. Healthcare, what do you have to do? Call the doctor's office 9 to 5, Monday to Friday to get your lab results. Or you wanted to take a plane or schedule a hotel. You can do that anytime you want, whenever it's most convenient for you. In healthcare, you've got to call the office or make an appointment when the doctor's office is open. And this coming Monday is tax day. Should have been the 15th, but because of Washington, D.C.'s holiday, it moved to Monday. Most Americans will send their information in electronically. And if you can send an electronic form to the U.S. government, why should you have to drive to the physician's office to get a written form if your daughter wants to go to start at kindergarten or play soccer?
Right.
It makes no sense. It is so far behind the rest of the world. Healthcare is going to have to change. The point I make to the physicians in there is that Borders didn't want to change, Kodak didn't want to change, the cab drivers didn't want to change.
Right.
What do we see? We see Amazon, we see Apple, we see Uber.
Right.
And the organizations didn't change, either out of business or going out of business. Consumerism in healthcare is the next wave, and those doctors that think that their time or their convenience or their preferences are more important than their patients, I guarantee you they're going to pay a price.
Well, we certainly don't want your choice to change every year, Dr. Pearl, when we see you here. What keeps you coming back to this conference?
Yeah, this is a great conference because it brings together people from so many parts of the healthcare world. You have the insurers, you have the hospitals, you have quite a number of policymakers, you have media, you have physicians, you have a lot of people coming here into the same room to share thoughts. And the biggest learning I have every year is until you have those conversations, you don't realize how different the views and perspectives are. And to me, it's not at the policy level, it's really at the personal interactive one. And more often than not, if an insurer can really understand what it is a physician or a hospital needs, or if a physician or a hospital can understand what the insurer needs, it's actually may not be that hard to accomplish. Yeah. It's just that those dialogues never happen, and the World Healthcare Congress lets it happen every single year.
All right, Dr. Pearl, thank you so much.
Thank you, Mabel. It's always fun. See you next year.
Great to see you. And I'm Mabel Jong. Thanks for watching.